So welcome everybody, it's lovely to see you today. Thank you for making time to join us during your day. I'm delighted to welcome you to this webinar on behalf of the Mind Matters initiative, which is an initiative that was launched in 2015 by the Royal College of Veterinary Surgeons and is funded by the Royal College of Veterinary Surgeons. It aims to improve the mental health and well-being of the veterinary team. I'm delighted to be representing the task force today. My name is Dr. Rosie Alistair and I am the manager at Veterinary Helpline. I'm really pleased to be here today for this session as part of Neurodiversity Celebration Week and to have such a fantastic panel to discuss our topic today, which is autism and the veterinary professions. Before we introduce our panel, I've got a couple of points of housekeeping. We would love for you to say hello in the chat and introduce yourselves and tell us where you're joining from. Please do make use of the chat. Please make sure you've got it set to all panelists and delegates so that you can speak to everybody. As I mentioned already, if you can stay on mute, that's brilliant. But we would really encourage questions for the panel today. We'd really like you to be part of our discussion. So if you do have any questions for the panel, please put those in the chat as well. And I will be looking out for them and I will be addressing those to the panelists. If you would like to ask an anonymous question, if you send me, Rosie Alistair, a private message in the chat, I will ask it anonymously. If you put it with your name on it in the main chat, I will ask it using your name. We are recording this session, so do be aware that any comments that you pop into the chat, we may well be reading out and they may well be recorded. As I mentioned already, just if you can make sure that you remain on mute, that will definitely increase the audio quality for everybody. I'm really delighted now to introduce our panel who are joining us today to talk about this topic. First, I'd like to ask Dr. Kirsty Pickles to introduce herself. Kirsty is Clinical Assistant Professor in Equine Medicine at the University of Nottingham. Kirsty.
Thank you, Rosie. So I graduated from Glasgow in 1996. I've worked in both private practice and academia. I like to think academia is sort of my natural environment, and I was diagnosed last year at 47 as having high functioning autism, which has been a very positive experience for me because it's helped me explain a lot of my difficulties throughout life, things that I've struggled with. So it's interesting when you wait to 47 to find out such a life-changing diagnosis, but it's something I'm still coming to terms with, but in a very positive way.
Thank you, Kirsty. I'm really glad you could join us today. I'd now like to invite Dr. Emily Craven, who is Ruminant Clinical Director at Oakwood Vet Group, which is part of Vet Partners, to introduce herself. Emily.
Hi, and I will say, because I've got the chat going on, Suzanne said diagnosed yesterday, so I'm going to say congratulations. I think that will be, I hope, a really positive experience for you to take forward. So I am a farm animal vet. I graduated from Cambridge in 2013. Like Kirsty, slightly later to be diagnosed, although I was diagnosed about 26. In all honesty, I knew I was different as a kid, no idea why. And actually, it was when I was in Cambridge and reading one of their alumni magazines, which are always high above my pay grade. I don't understand them, but they had a great article by Simon Baron-Cohen talking about Asperger's in girls. And it was a bit like, oh, that describes me. Wasn't ever going to get diagnosed, thought I could cope without. But to be honest, found challenges in farm animal practice. I was struggling, ended up with depression and anxiety. And it felt like getting the diagnosis would be an important step forward. So I sought my diagnosis in 2015. To start with, I was very private, quite embarrassed about it. And now I just think, hey, it's me. It gives me great qualities. It makes me who I am, and it makes me better in places. So yeah, out and proud.
Brilliant. Thank you, Emily. And lastly, I'd like to invite Carl May to introduce himself. Carl is a joint venture partner at Alsager Vets for Pets in Cheshire.
Hi, my name's Carl May, veterinary nurse, qualified in '96. Not diagnosed autistic, but last year I was diagnosed ADHD. Again, I always thought there was something slightly amiss and had to chase it quite hard. Again, as Emily said, there are definitely good things. It makes me very driven, and now receiving treatment, it takes away the bad side. My involvement with autism in particular is that we were the first practice to be awarded the Autism Friendly Award, making it easier for our clients that may be on the spectrum to access veterinary treatment.
Thank you, Carl. I'm really looking forward to panelists answering some of your questions and discussing some of the topics that we wanted to discuss today as well. I know a few people have joined just a little after the introduction, so a very quick run over of the introduction. Welcome to this session. We're delighted to be here talking to you today. If you could all stay on mute, that would be brilliant. If you have any questions, please pop them into the chat and we will answer as many as we can. Please also introduce yourself in the chat and say who you are and where you're joining from. And if you would like to discuss with others in the chat, that's fine by us as well. Use it as much as you like. So I thought we might start our discussion with quite a broad question for each of our panelists, and I'm going to ask Kirsty to answer this first. How would you explain autism to someone who doesn't know about it?
So in its simplest terms, I would say it's a different way of thinking. The person who first termed the term neurodivergent actually said that, you know, there's infinite number of ways that the brain can be wired, and neurotypical people generally think along a similar pathway, whereas neurodivergent people, like autistic individuals, will think along different pathways. So that's in its broadest terms. Particular things that autistic individuals might struggle with are aspects of social communication, being hyper or hyposensory stimulation. And it's important it's really important to me, though, to point out that it's a massive spectrum. There is no, this is what an autistic person looks like. It is a massive spectrum. And so there are a million different ways in which autistic people can present, and each person essentially has a profile of traits, and some traits might be more strong than others. So they might have some particular strengths, they might have some weaknesses, but altogether it's a profile. And those traits will also be seen in neurotypical people. It's just that they are particularly pronounced in neurodivergent people.
Thank you, Kirsty. Emily, would you be able to explain autism to someone who doesn't know about it?
Yeah, I found this one a really hard one when you sort of put that question to us to think about, and I thought, oh God, what is it? And I actually resorted to Google and tried to find a definition, and I still couldn't really find a definition. And there's a few people that sort of have definitions, and they're all similar, different, not very clear. There doesn't seem to be a sort of gold standard definition, which is like vets we all like within that sort of veterinary industry. You could definitely come up with things that it's not, like, you know, we're not that sort of stereotypical stimming savant that, you know, they like to portray on the TV, but I think, you know, it's going along with what Kirsty said. It's a spectrum condition. It's going to affect behavior and communication and your sort of sensory pathways, and it just means that we might sort of, an autistic individual is going to perceive a situation slightly differently from a neurotypical individual, but at the same time, as you say, we're all on the spectrum, we all have our traits, and even neurotypical people would probably go through some of the autism sort of diagnostic questions and associate with them at times. So yeah, I think it's just the spectrum bit. And I think, to me, the bit that I would take out of the definition that seems to be is the disability and behavioural problems that a lot of people seem to write in. I don't think we've got behavioural problems by being autistic, and I don't really see it as a disability. It's just a different ability. So yeah, that would be my sort of additional thoughts, but really largely agreeing with what Kirsty said.
Thank you, Emily. And Carl, how would you explain autism to someone who doesn't know about it?
I'm coming from a slightly different angle on this, because obviously I haven't been diagnosed like Emily and Kirsty. So Mine is more of a Google one, I'm afraid, but for me, it's a developmental condition that stays with the person for life, and it can affect things like the way a person might communicate or interact with people, and often the individual may have either over or under sensitivity to certain stimuli, so light, sound, smell, anything smell. We had a student with us from a local group who was autistic, and she was particularly set off by anybody sniffing, for instance. So it can be something just as little as that.
Thanks, Carl. Thanks so much to all of the delegates who've been putting questions into the chat. If you have any questions, please do add them into the chat. This is very much going to be a session where the panel help to answer your questions and we have a discussion based on those. I'd like to start with one of the questions from the chat, if that's okay. And it's a question from Penny Clark, who says that she supports her autistic son, and they've had a steep learning curve in autism. She writes for an autism charity and advocates in many areas. She's keen to advocate for veterinary staff. She wonders what the panelists want to see from the Royal College of Veterinary Surgeons. So, Kirsty, do you have any thoughts on that one?
I think the main thing any organisation can do is to promote inclusivity and provide a culture where people feel able to talk openly about these things. You know, as Emily mentioned, that, you know, she wanted to keep quiet about it first to begin with. People don't like kind of standing out, and that's actually particularly a problem with autism diagnosis in girls, because they very much want to fit into societal norms so they can go under the radar, which is why people like me haven't been diagnosed till 47. But so I think, you know, I think the Royal College, just by hosting this webinar, are, you know, making a great start, showing that, you know, this is okay to talk about. I work in academia, so I would like to see much more inclusivity within vet schools. And I don't mean from the perspective of sort of culture and being open, but I mean more about the curriculum, making the curriculum more accessible to neurodiverse students. I think there's things that can be done there. And I think certainly there's more research that could be done within neurodiversity within the veterinary profession.
Thank you, Kirsty. Emily, do you have any thoughts on that, or on the points that Kirsty was raising about education and research as well?
Yeah, I think, to me, I think it's just the promoting the inclusivity bit. I mean, I sort of don't really want to jump on a bandwagon and have excess sort of attention because I'm autistic, but at the same time, it's just that reassurance to know that it's okay. And, you know, promoting that to the outside world, because, you know, it did worry me, clients finding out that, you know, them probably saying, you know, I don't want the autistic vet, or, you know, will she not interact with me properly on farm, or will she be, you know, so there is that side of things. But I guess also knowing that there's people within the organization that do understand and care, like, you know, I mean, we're all sort of brought up going through vet school living in fear of ending up in front of the RCVS, and it's great that the RCVS has a much more supportive role now, like doing things like this and promoting the Mind Matters initiative. But, you know, I think it would be nice to know that if you ever did have any dealings with the RCVS in a professional capacity, also there would be people that really understood that you would, you know, I mean, everyone's going to have heightened fear when you have things like that, but just knowing that there's mental health first aiders, people that understand neurodiversity, things like that, would probably be my different take on, you know, everything that Kirsty said. But that would be my additional point, just to know that, you know, that the support would be there and people understood.
Thank you, Emily. And Carl, what do you think about this question in terms of what you'd like to see from the RCVS?
think for me, and I'll probably repeat myself on many of these questions today, but for me, it's about awareness. That if the more people that are aware of autism and the way it may affect people, it then makes it easier for us to help people that are on the spectrum and to have that understanding that we're not all the same. But it also would then make it easier for someone that is on the spectrum to actually ask for assistance, rather than it be like a stigma, or like Emily said, about feeling almost embarrassed or worried what people are going to think. That it's a very common condition, and it really shouldn't be something that anybody should be feeling in that way about.
Thanks, Carl. We've got a lot of brilliant questions in the chat. Thank you so much to everybody who's talking in the chat and who's asking questions. I'm going to ask an anonymous question that I've had next, if that's okay. And the question is, are the panel able to offer any reassurances about how career prospects might be affected by having an autism diagnosis? And I think from the wording of the question, it's concerns about how others might react to an autism diagnosis. I don't know if, Emily, would you like to go first?
Yeah, I mean, I can go first with pleasure. I feel like my career has done much better since I've had my autism diagnosis. So if you're living in fear, yes, I can totally relate to that, because I thought that getting my autism diagnosis might be the worst thing that ever happened, because then I would officially have a label and I would be held back, which, that's 7 years ago that I thought that, and I hope the world's moved on, but I did feel that, and I felt that fear. And quite frankly, having my autism diagnosis has given me a better understanding of me. It's given other people a better understanding of me, and that's enabled me to be a better version of myself. And therefore, I think that helps me develop my career, because I'm actually happier and I'm easier to work with, and people can understand when I react slightly differently to something. To be honest, if the sort of people that hold back your career, if there's people around that hold back your career based on your autism diagnosis, actually, yes, they need to learn, yes, they need to understand, yes, that needs sorting out in itself, but actually those aren't the people to have in your team around you. And quite frankly, the team I'm working with now are super supportive. Like when I said I wanted to do this webinar today, I didn't have the backup, but they made it happen, because they are supportive, they get it's important to me, and they care about me, and they see me for my benefits, not my problems. Well, problems, that's so harsh. I hope I'm not problems, but you know what I mean? They don't pick out the negatives of the autism. They see it as an asset. And I do bring a lot to the table. I bring a lot more to the table, and I bring different skills to the table by being autistic. And actually, if I'm the one autistic person in the room, actually I'll bring totally different stuff to the team, and that brings the diversity and brings the difference in thinking. And so yes, I can only say that from my perspective, being more open and honest about it has been, I certainly don't feel it's held back my career. And I think accepting me and working around that and working with it has definitely promoted my career, because I'm just a better version of me, and makes me a better vet.
Brilliant. Thank you, Emily. Kirsty, do you have anything to say to the person who's asked the question about reassurance to do with career and how it might be affected by an autism diagnosis?
Yeah, I would echo a lot of what Emily's said. I mean, obviously my diagnosis has been quite recent. So I went through quite a lot of my career not knowing, but I have recently started it at Nottingham, and I did think twice about telling work, and because I had recently started, I didn't want to immediately be kind of going in and saying, I need adjustments, or I need anything extra than your average person. I didn't want to be seen to be extra work or anything, but I did speak to my line manager about it, and work has been, couldn't have been more supportive, and it's been a really, really positive experience for me. And so that's the first group of people that first employer that I have told, but I did actually retrospectively go back and tell a previous employer and said, I want to tell you this, because I think it will explain some of the sort of the reasons why I didn't handle these particular situations well. and got a lot of understanding from them as well, and had only positive reactions as well. So I think it's you know, a natural reaction to worry about, but I, like Emily, I've only had positive reactions.
Thank you, Kirsty. Carl, did you want to answer this question?
Yeah, I mean, again, echoing what the other guys have said, really, although I can't, once again, I can't speak from someone that's been diagnosed with autism, but from somebody that's been diagnosed, again, recently with ADHD, it's similar for me. I mean, I was pretty sure I had it anyway. It was just a matter of getting that nod from the doctor. But again, it's allowed me to understand me better. It's allowed me to speak to people about it, kind of embrace it, but not use it as an excuse for some of my behaviours, maybe. But also, the same as Kirsty, I have spoken to a few people from the past and just explained, being able to explain a few things that maybe I've dealt with, not in a way that I would wish to, but being able to understand it and therefore be able to help other people understand. And I certainly find my team here, for instance, very, very supportive of it, and I don't think anyone was surprised, if I'm honest. But I know that's not coming from an autism point of view, but it's quite similar for me.
Great, thank you. So some of this discussion leads on to another question that's come up several times in the chat, which is people wondering about how you might go about getting a diagnosis of autism. Kirsty, would you like to go first on this one?
Sure. So I guess my route was a little atypical in that I would never have probably ended up being diagnosed if it wasn't for my daughter being diagnosed. And when we got that diagnosis for my daughter, who's 9 now, we got that last year, so my typical response to something like that is I go away and read absolutely everything I can about autism so I can help her. And I started reading about girls and women on the autistic spectrum, and just found myself identifying with so much of their lived experience that I really began to question whether I was on the spectrum. And I asked my husband what he thought, and he said, well, yeah, I've always thought you could be on the spectrum, actually. And then I spoke to my parents, and they were like, no, there's no way. But by this point, I had enough sort of doubt in my mind that for me, it was really important to go and seek that diagnosis, because I felt it would explain a lot. And so I went back to the people who diagnosed my daughter. We went privately with my daughter's diagnosis, and therefore I went private because my daughter we'd already waited a year on the neurodevelopmental pathway with my daughter to even get to see a paediatrician. And they told us that it was going to be another 2 years before we saw someone for her diagnosis. So I just, to me, I wasn't prepared to wait that length of time for my daughter. So we went privately at that point. So I just went back to those people and I actually asked for a frequent flyer discount, which they gave me. And within 4 weeks, I had my diagnosis. So certainly I didn't want to go to the GP, felt I had to justify, which is, of course, the other pathway. You can go to the GP, say you tick all these boxes and ask to be referred for diagnosis. But again, that's going to be a really, really long wait. And to me at this point, again, it's probably another autistic trait. But once I decided I was going to do this, I needed to do it and I needed to know the answer. And it was probably the best £1,500 I've ever spent in my life.
Yeah, thank you, Kirsty. Emily, was your path to diagnosis similar to what Kirsty's described?
Well, similar in some ways, obviously very different in others. Not got children or anything like that, so it was very definitely through me. I was going through a period of quite a challenging period at work anyway, and I was off work with anxiety and really struggling, and went down the GP route first, because I think work were quite keen for me to have a diagnosis, and I was at the feeling that I thought it would help me too. Went down the GP route and sought a referral, but was clearly going to take a very, very long time. And I think for me, and I was sort of torn, going, well, I know I'm on the spectrum, so it doesn't really matter. Does it matter? Do I need it? I was at that point where I thought it might be negative to have that label, so I wasn't sure. I was almost happy to wait it out. But work were quite proactive and positive in pushing me forward to get a private diagnosis, and actually paid for that as well, which was really supportive. And it was only afterwards, when you found out that the sort of the people that had driven that through, and actually realized quite how grateful you were to them, and I will always be grateful to them, and I hope they know that. But yes, so for me, I went privately to get a quicker thing, and but that was very much from support through work.
Great, thanks, Emily. And I hope it's really reassuring to some of the delegates here today to hear people's experiences of supportive workplaces on this. It's so important that workplaces are supportive, and it's really great to hear those examples. Carl, are you able to speak a bit about your ADHD diagnosis and how that occurred?
Yeah, it was as a result of many years of depression and counselling and behavioural issues from a very young child through to an adult, really. It affected my private life, my work life, everything I did, really. Labelled as a naughty boy, so played up to it for quite a while, and then eventually you kind of realise you've got, there's something needs to change, and they try all the medications and all the counselling and whatever which is probably secondary depression due to the ADHD and how it has resulted in me being treated. And then it was I had to chase it quite hard, but I just went through the GP. Eventually I found a really understanding GP, and it once that ball was rolling, it was literally went into a room with a doctor, psychiatrist, answered a questionnaire, and I was almost to the point where I was trying to answer questions to make me not sound so ADHD, because it was like I was just ticking all the boxes. It was quite a relief, I'll be honest, to get the diagnosis, because without it, why else was I behaving how I was behaving? So I was a bit worried about that. And then I take a tablet every day, and it's made a massive difference to my life.
Brilliant, thanks, Carl. Kirsty, did you want to say something else about this?
Yeah, it's something came back to me as well, in that similar to as Carl was saying, for me it was a relief, because it explained a lot of sort of past stuff. But I'd been treated for anxiety and depression for many years, and so I had seen multiple psychologists and psychiatrists and counsellors over a sort of 20-odd year period, and never once had any one of those queried that I could be autistic. So even within the medical profession, particularly in women, autism is really not on their radar for a lot of things. And my anxiety and depression was largely secondary to being autistic, living in a neurotypical world, and now having that diagnosis really helps with that. And my stresses with work were trying to mold myself into a regular situation and struggling to be able to do that. So so what I'm trying to say is that you need to see the right person. You need to see people who are qualified and specialists in seeing autism as a diagnosis, not just because you've seen a psychologist and they haven't mentioned it doesn't mean to say you're not autistic, because I had to see specialists to get my diagnosis.
Thank you, Kirsty. Emily, did you want to say something further about this as well?
Yeah, I think it's just following on from what Kirsty said. I would say also don't take no for an answer if you find that you're up against the wrong people, because I get it now, and I get it from the public. I get it from not necessarily colleagues, because I think colleagues get it when we discuss it and they know. and they know me well enough. But you even get it from medical professionals, and you sort of say, well, I'm autistic, and they look at you and they go, you're not, and you go, yeah, yes, I am. And that, you know, because you can mostly hold eye contact, it may be that you're actually kind of looking through someone, not necessarily at them, you know, but I can mostly hold a good conversation with a degree of eye contact, and especially when I can slightly control the conversation rather than those kind of some of those social situations you do find very hard. But because you can exist in everyday life, people go, well, you're not autistic then, and actually you are. You tick every box, and you're the most, you know, when you go through the things, you're fairly clear cut. There wasn't any question about that. But you know, and you get that from sort of the public, because, you know, people don't necessarily understand and know about the specifics about girls, which, you know, make it even more challenging, because you're not just that stereotypical boy that you read about in the textbooks. But yeah, when you even get it from medical professionals, that is incredibly frustrating.
Yeah, thanks, Emily. I think that's a really important point. It brings us on to another question that I know we thought about discussing, which is, what misunderstandings about autism have you come across, and what would you most want people to know? Kirsty, would you be okay to go first on this one?
Sure. The biggest probably couple of misunderstandings that I think are out there are that an autistic person looks like this, and, you know, they're a train spotter who, you know, doesn't look you in the eye, and you know, can't hold a conversation with you. And it is a whole spectrum, and that's everybody has their own profile, so it's not a one size fits all, which is why there is no one size fits all how to address equality in the workplace, or how to adapt the work environment for autistic individuals. For each autistic individual, that would be different, and you need to ask them. And the other thing is, which I really have a massive dislike of, is when you say that you're autistic and someone says, oh yeah, I'm a little bit autistic too. I like to stack the dishwasher a certain way. And you think, actually, you know, that's just so missed the point, and actually that's really offensive, and it really belittles a lot of the major difficulties that I might experience, and so try and avoid saying things like that, please.
Thanks, Kirsty. I think that's really helpful for people to hear. Carl, what misunderstandings have you come across about autism, or also about ADHD, if you would like to speak to that as well?
I mean, obviously, I see it more from a team's point of view towards clients. So often, because maybe people on the spectrum will sometimes find it more difficult to communicate in certain ways, then that person might be seen as maybe difficult, unintelligent, which is obviously not correct at all, and weird, you know, which is, you know, it's, we now, with our reward, and the reason for doing it was to be inclusive and to be understanding. We have a basic rule within the practice that we try to be understanding of everybody. It's not just anybody with autism or anything else. It's just about being kind and understanding that there's a story behind everybody, really. So particularly when it comes to when someone's phoning about their pets, they're worried about the pet, they're worried about money, but there may also be other things going on with them. So when we opened the practice here, I was very keen to kind of get out of any bad habits that I've seen in other practices. So that's one of the reasons we did. We went for the award. Particular, even with a colleague that that was with us originally, she isn't anymore, but they thought that their own child was showing some signs of autism. So I did say, oh, you know, why not go get tested? Why not look into it? And their response was, we don't want him to be labelled. So, you know, it just speaks volumes, really. So I think even if a parent is feeling that way about the stigma of a condition, then you know what chance to some other people stand, really. You know, it's so for me it's all about just making awareness. It comes down to awareness again for me.
Thank you. Would you be able to say a little more about the award that you have and the process of getting that?
About the award, yes, it was done through the National Autistic Society. It wasn't particularly difficult. It's 5 modules that you do online, going into various parts of autism and how to help people, or just understanding. And then it was just a few very minor changes in the way that we do things. So we're very lucky that we have quite a spacious practice anyway, so it means that we're able to set aside a quiet area for people that might struggle a little bit with, you know, excess noise. We changed, or we made available a way of making appointments by email, or chatting to us by email, because my understanding was that some people on the spectrum sometimes struggle with conversation, either face to face or on the phone. They sometimes need a bit more time just to take in what's been said, and then consider their response. So it takes the pressure off that way. Again, little things like making appointments in the consulting room, so someone doesn't have to go and take a payment, so someone doesn't have to deal with an extra person. We've had a Google tour done of the practice, so people can get in their mind's eye, you know, their journey through the practice, even down to I did a course on Makaton, so because a lot of particularly autistic children, that's a way of communicating for them. So just it wasn't a lot of work. So I think a lot more places could do it quite easily.
Thank you, Carl. That's really helpful. Emily, thinking about the misunderstandings and what you would like people to know, are there any more that you wanted to mention? I know you mentioned one already, which was...
Yeah, I think probably just as Kirsty kind of alluded to, just seeking to understand and you know, communicating with people how they would like to be communicated with, rather than actually how you want to communicate with them, and that, you know, actually understanding people's differences. And I think that's not necessarily going from the neurotypical neurodivergent pathway. I think that's just anything, whether, you know, somebody's a very direct personality or a very sensitive personality. We're all different, we all function differently, and autism, ADHD, anything like that doesn't necessarily make it any different to how everyone has their different communication styles and understanding. But I think also just seeking that little bit of understanding about autism, just to know when things are going to be harder. You know, like, I am not very good at conflict. I struggle with those conflict situations. I've, you know, even as a clinical director, I hate the conflict. But I've got a super supportive practice manager who, when I ring her up and say, oh God, I don't want to do this, she'll either do it for me, or she'll help me find a way to do it. And, you know, we can talk it through. And it's just that understanding of knowing, but also when someone's going to throw a curveball at you, you know, everyone struggles with change. You know, you see all these grief curves, and you can see everyone identifying in them. I think sometimes with the autism, for me, I definitely do change less well than others. I'm getting better at adapting to things, but it's not something that comes naturally. And so I think for me, it's about, you know, understanding that, you know, handle that one sensitively. And if you introduce change gradually, or just give me time to process it, I'll come back and I'll be fine. But if you get me at a really bad moment, give me a complete curveball of change, you might not necessarily get the most positive response out of me and what you want out of me. And rather than sort of seeking that as a, oh God, Emily's going to explode or whatever, I mean, hopefully I wouldn't explode, but I might not sort of react completely positively. But it's that kind of actually understand that that's a very typical behavior for me in terms of my autism, and therefore just approach that one with some understanding about how I'm likely to feel.
Thanks, Emily. That's really helpful. It's really interesting hearing you talk about adjustments that have been helpful, particularly in support from management. And that's something I'd like to ask about a bit more. We've got some great comments in the chat. Elizabeth has said she'd love to see information distributed to managers to promote the issue of the number of undiagnosed people in the profession, and more could be done without singling out individuals. I wanted to ask about adjustments, and I was wondering, Kirsty, if you would be okay to go first on this one. So what adjustments do you think could help autistic veterinary professionals in practice?
I think one thing I would advocate that the person could do themselves is that I think they should play to their strengths. So for me, I'm like Emily, I don't like change. I like structure, I like routine, and I find sort of urgent situations very stressful and tiring. So for me, clinical practice is quite exhausting because it's much harder to predict your day, and those curveballs seem to come quite frequently with emergency cases dropping in on you with no preparation. I'm also really not good if I don't eat, so missing lunch and things like that sort of affect me. For me, working in academia really plays to my strengths, and so I find that there's more predictability. It's a really stimulating environment. I love the teaching aspect. I love the research aspect as well. So that really plays to a lot of my strengths. The sort of attention to detail, writing grants and things, that's quite a strength of mine. So I think that's something that people could look at themselves honestly and say, okay, what are my strengths? What are my triggers? How can I avoid those? And there are definitely pathways in the profession which will be easier for you, I think, than others. So that's definitely worthwhile thinking about. And from a organizational point of view, I think there really needs to be a conversation between the individual and the organization to find out what that person really needs. And that's very individual. So, some people will be very sensitive to bright lights. I'm not, but other people are. So, they might need to be able to wear sunglasses all the time, or, might need to have a special screen, or, something like that. Noise cancelling headphones, if you're particularly sensitive to noise, is a really easy adaptation. I find that it's really difficult to have back-to-back meetings. I find meetings quite intense. Like after this webinar, I'll have to just have a decompression sort of time that I kind of sit and don't do anything because I'll be quite tired after this. And I find, just simple things like that, having some downtime between meetings, having a quiet space to be able to go to is really useful. But it will be different for every individual. So there needs to be a conversation around what that person needs. And from a whole organization point of view, as we were saying before, the culture, comes from top down. So the culture should be about inclusivity and openness and promoting that.
Thank you, Kirsty. Emily, would you like to add something about adjustments for autistic veterinary professionals in practice?
Yeah, I think I'm very similar to Kirsty in the playing to your strengths. I mean, you can go and ask for specific adjustments, and legally speaking, your practice should follow that. And if they care about you and want to invest in you as a person, they should. But I think for me, it was about finding my niche. I have survived in clinical practice. At times I didn't think I would. But I think for me, I really like the pre-planned work, the routine work. I am the weird farm vet that actually really enjoys a good TB test because it's safe and I know what I'm doing, and I'm quite happy to go and test 800 animals in a day. I'd rather not do it every day, but you know, so for me that works. And actually, you know, the older I've got, yes, I've probably become more self-aware, but I've also got more senior within the practice, so I've got a little bit more sort of, I get more of the routine work, and that works for me. And again, in my practice, we see that as a positive, because I've got some vets that the last thing they want to do is go and write a health plan, go and do a TB test and all the rest. So they can field all the emergencies and do the fire brigade work, and I can do my pre-planned work, and everyone's happy because we bring different aspects to the team. We're not fighting for the same work. But I think also, you know, it is about finding work that suits you. Like when I, a few years ago, before even Brexit was mooted, you know, there was export work needed doing in the practice. And my boss came to me then and said, how do you feel about doing that? And I think, you know, he wouldn't necessarily have called it an adjustment for my autism, but at the same time, nobody else in the practice necessarily wanted to do that very process, detail driven stuff. Whereas I actually found it quite satisfying because it was very processed, it was controlled, it was driven, it was detail, and it's the sort of, you know, it's playing to my strengths again. So I think, you know, the adjustments is just finding out what people need and making it work. And as I say, actually, the more different and diverse people are in the team, actually, I think the more happy you can make yourselves as a team, because you can be more, as long as you can understand each other and get on, you can be a lot more cohesive, because you're not fighting for the same work. You're not constantly treading on each other's toes. You go, well, actually, the last thing I want to do is go and do that call, but actually Emily will love it. So let's slightly engineer that situation. And, you know, yes, I'll still have to go and do the work I do. I don't want to do. Yes, I'll still have really stressful days where I'm all on fire brigade stuff and I can't plan 1 minute to the next, and I feel quite stressed by it. But I think, you know, the adjustment to me was just actually, and the understanding was just playing to my strengths and going, it's okay if Emily has a reasonably full diary because she feels quite safe and you probably can't slip a carving in there. So I'll take the busy day over sitting and waiting for the emergency any day. So
that's brilliant. Thanks, Emily. And it's so important, that point that you were making about diversity enriching our teams and enriching our professions. And it's really good that we're talking about the benefits of autistic individuals in veterinary teams. Carl, we've had another question in the chat, which takes this question from a slightly different perspective. And I wondered if you might want to answer this. Claire's asked a question about particular adjustments for communicating with neurodiverse members of the public. And I wondered if you wanted to address it from that perspective.
Yes, again, it's just about, as Kirsty said, everybody on the spectrum is slightly different. You can't pigeonhole everybody with autism as the same. So if somebody was to come into the practice and said they were autistic and were struggling, then we would probably just speak to them, to be fair, and see which way they preferred. So a lot of people will just go for email, and again, it's or Facebook Messenger, anything that gives them a little bit of time to consider what we've written, and also to consider their own response, rather than feeling the pressure of having to give a response straight away, or to take in information, process it, and give something else out straight away. So it's all about, for me, it's about using whatever method that individual prefers. Does that answer the question?
It does.
Yeah.
Thank you.
Yes.
Thanks, Carl. Did you have a question for Kirsty?
Yeah, sorry. Yeah, just if you don't mind. Obviously, we've done the Autism Friendly award with the changes that we've made. I mean, obviously, you guys have very much embraced your condition, if I can call it that, and its strengths, and you've very well been able to kind of make it fit into the way you do things, which is fantastic. I mean, we do that, you know, from my point of view, as someone suffering from ADHD, if you put something like the practice standard schemes in front of me, forget it, it's not going to get done. So I'm quite honest about things. There's no chance I'm doing that. I'd rather be, you know, consulting, operating, anything other than anything like that. But I'm aware of that, and everybody else around me is aware of that. So it's always good, regardless of people's conditions, to have that diversity. But as people that have been diagnosed on the spectrum, do you worry about going into businesses, for instance, your general shopping, your general whatever you might do, and would you feel more comfortable knowing that a business had the Autism Friendly Award?
Personally, I'm not affected by going into a business because that's on a sort of professional footing,
Yeah.
and I kind of know what my role in that procedure is. I do worry about like taking my car to a garage, because I just worry they're going to look at me and take advantage of me. But I think probably a lot of women
worry about that.
yeah, a lot of it. So professionally, actually, in a sort of, you know, situation like that, I'm okay. I struggle much more socially, and you know, a large group of people socially is a far more frightening thing to me, and I, you know, would have a tendency to avoid that situation, even if sometimes if that's within work. So that's another thing that workplaces, I think, should be aware of, that just because someone's not joining some coffee and cakes thing at break time, it's not necessarily that they don't want to, it's actually that they can't. And then what often happens is some aspect of work is discussed at that coffee and cake thing, and then you haven't been party to that, so things have moved on, and you're kind of left out of the loop. And that's one of the ways which you can be really excluded in a workplace and feels very uncomfortable and isolating.
Yeah, I'm the same, to be fair. I'm absolutely the same.
But I think I do think it is a really good thing that businesses do get that autism friendly thing, and that's, you know, my perspective. And I could imagine some people finding that really, really helpful, particularly the ones with sensory perception differences, hugely helpful. You know, that's not really one of my areas that I struggle with, but I mean, I think it's a great thing to be part of.
Okay.
Yeah, so I agree with Kirsty. I think, like, absolutely agree. You know, for me, it's the social situations that I find harder. You know, anything that I can sort of pre-plan in my head is a sort of transactional arrangement, that's fine. You know, you walk into a shop, you know what you need. Although having said that, I'll be honest, if I walk into a shop, not that we've all done that for years with COVID, but, you know, and the person sort of tries to catch your eye and goes, hello, can I help you today? And you're like, oh shit, run a mile. Sorry. You know, you need to me, it's, so I think in those situations it would help, the fact that they would leave you quiet. I think it's more the it'd be nice to have that tick though in the things. It just shows that they're understanding and they care. And although I don't need it, I would, but I think it just shows such a good attitude. It's just a welcoming environment. It just shows that people care and they've taken the time to stop and think. And whether I need it or not, I know that others would benefit from it. And I think that is that would be, I wouldn't need it, but I would really value an organization that valued that.
Yeah, it's like seeing a wheelchair ramp, isn't it? You know, I'm not personally going to use it, but I certainly appreciate that other people will, and that the workplace has thought about that. So, you know, I sort of see it on the same front as that.
Yeah, I think for me, it's not about, I don't expect everybody to come in to the practice and tell me whether they do or whether they don't suffer from autism, but I'd like it to mean that they can come in and just know that we understand. That's all it has to be sometimes. Often we don't have to do anything more than that. No,
it's just facilitating people to feel safe in your environment.
Yeah, absolutely.
And I think that you know, it just shows a great investment in the value that you place on your customers and your clients.
Brilliant. Thanks everybody. That's such an important point, isn't it, about that visibility and acceptance. The time has gone so quickly in this session. I wanted to mention just how great the chat has been in this session. Thank you so much to our delegates as well as to our panelists today, because I've seen a lot of our delegates answering others' questions in the chat and having really helpful, supportive conversations. So thank you so much for being part of this amazing session. I wanted to finish, if that's okay, with an anonymous question that's come in the chat. So just a few final thoughts on this question. Okay. I know this relates to the experiences you've spoken about, particularly Kirsty, but I'd be interested in hearing what Emily and Carl have to say as well. And this question is about what advice the panel would give to parents who are supporting autistic children. Would any of you like to go first?
So,
oh, go ahead.
Sorry.
Go ahead.
I mean, for me, as somebody that went, and I wonder if Kirsty, but maybe feels the same, and Emily for that matter, sorry, somebody that's kind of gone through life with struggles due to an undiagnosed condition. I mean, nowadays these things are a lot more recognised. I think sometimes almost over-recognised if we're not careful. But to just reach out for help and be aware that there's help there. The very fact that we're having this conversation today means that the world has moved on, and people are genuinely willing to recognise these conditions and try and make life easier for everybody. I think people are just more inclusive nowadays, and we are trying to just be kind and treat one another well, regardless of condition or anything else, but also not to necessarily see it as a label, and not certainly not a bad label. Look for the good in it, and definitely kind of embrace it to a degree. So the sooner you get a diagnosis, the sooner that individual can deal with what they need to deal with.
Brilliant, thank you, Carl. Kirsty.
Yeah, I would agree with that. You have to be your child's advocate, and I can't emphasize that enough. My daughter's school didn't think she needed, they didn't think she had special educational needs. They didn't think there was anything wrong. I had to push for 2 years to get the process going. And you really have to advocate for your child all the time, because they are too young to do it. And I equally had people telling me not to seek a diagnosis because why would I want to label my child with such an unhelpful diagnosis? And as Carl said, having struggled with sort of the consequences of not being identified, I felt it was actually really, really important to go down the pathway. And it has only been beneficial for holding school responsible for doing something and getting her needs better met. I don't think even yet we have got her needs met, but it's at least we're moving forwards. And I think you need to trust your gut instinct a lot of the time. And if you think there's a problem, there is a problem. And don't listen to a teacher just because they're saying, no, everything's okay. What my daughter does in school is she is the perfect child who never says anything, never asks for help. And so therefore never got any attention in class. If she'd been a disruptive boy, sorry, Carl, she would have got help because she was creating a diversion and interrupting flow in the classroom. But, her freeze response, it was like almost selective mutism. She was unable to ask for help, and everything was just going over the top of her head. So, what I was seeing at home was a totally different thing, the frequent meltdowns. And, school couldn't understand that, well, why don't we see that in school? But that is really not uncommon, that kids will hold it together in school because they feel that they have to. And then when they get home, it all falls apart because that's their safe place. So, I get a network around you to support you, because it is stressful. It's far more stressful for me dealing with my daughter's autism than it is my own, because, you know, I'm trying to be protective of her and sort things out and advocate for her. And it, you know, I find it really triggers me, and I get very, very tired and emotionally overwhelmed by it. But at the same time, you know, there's no way I'm going to trust anybody else to sort it out or advocate for us. So, you know, do your best. That's all you can do.
Thank you, Kirsty. Emily.
Yeah, so I think for me, I find it interesting because I mean, I certainly I don't have children. I don't think I have a maternal bone in my body. I'm not one of the, you know, I sort of, so I've never really considered it from that aspect. But then whilst we've been talking about this, you're sort of thinking back to how my own parents dealt with it. And I find it interesting for Kirsty in the respect that, you know, dealing with daughter with autism, but then thinks back, you know, and I've considered my parents, and I don't think either of my parents are on the spectrum. So, you know, not quite sure where that has come from, if there is a genetic link, or whether there is, you know, we still don't really know the origins or the causes. But I think my parents would have definitely found it easier to advocate for me if they, you know, they obviously knew I was different. They obviously knew I didn't really fit in, but they tried to support me anyway. And they sort of tried to advocate for me through school when I didn't really have any friends and I didn't really fit in. But I think they would have found it easier to support me if they knew and they could understand, you know, like Kirsty said, you know, when we all got the diagnosis, what did we do? We all read around the subject and we all got an understanding. And I think some of the times where I would have probably got uptight over something that they didn't really necessarily understand where I was coming from. And maybe if I'd had that diagnosis, they would have understood it a bit more. And it's not a case of being more tolerant, but just having more of an understanding to help work through it, rather than just thinking, oh my God, Emily, you're actually ridiculous. So I think it's about that understanding and enabling you to be a better advocate. And I think, you know, I would hate for that label to be used as an excuse as such, but I do think that having the diagnosis is a positive, provided you use it as a positive and use it to understand and move forward, rather than to use it as an excuse to excuse for bad behavior, excuse for not actually fitting in, and just saying, oh well, I'm autistic, so it doesn't matter. It does matter. We have a duty to fit into society as much as anyone else does. But if you can use it as a positive for understanding, then I think it's a massive benefit to everyone. And I think for parents, it's going to facilitate them to be an advocate for their children a lot better, because you don't have to say take yes and no for an answer from the school, because you say, actually, no, you do need to support, and there is a reason for that, and it's not just bad behavior or because she's being difficult or anything else. So yeah, to me, it's about finding that positive and using it to everyone's advantage, because ultimately, if you're happy, you're going to make people happy around you. You're a better person to be around, so everyone's going to be happier.
Thanks, Emily. And certainly what you're saying there resonates with a lot of the discussion that people have been having in the chat about diagnosis as a positive and how much that can help. And it's great to see people sharing those experiences in the chat. I'd like to thank all of our delegates who've taken part in that chat today and been part of this session and part of the discussion. I'm sorry we couldn't get to all of the questions. There are some amazing questions there, but I think this is very much the start of a conversation that we need to be talking about more in our professions. I'd also like to thank our amazing panelists. I'd like to thank Carl, Emily and Kirsty, and thank you to the RCVS My Masses Initiative for hosting this webinar as part of Neurodiversity Celebration Week. Just looking ahead, there's another webinar on Thursday, which is about dyslexia in the veterinary profession, same time, 12:30. So if you're interested in joining that, have a look at the My Matters information that's available. That's the end of our webinar today. I just wanted to say thank you so much to all of you again, and we hope to see you soon. Goodbye.